Growing up, my neighbor had a foot amputation as a result of uncontrolled diabetes. I remember my mother taking my siblings and me to La Casa del Pueblo to pick up groceries for him. He didn't know about diabetic ulcers. His foot eventually became infected, and the infection did not go away as he'd hoped. He was afraid to see a doctor until it was too late. We lived just 6 minutes away from the Illinois Medical District. I grew up in Pilsen, a Latino neighborhood in Chicago's Lower West Side. I often walk to La Casa del Pueblo, our nearest grocery store. It's less than a mile from where I live. But on the way, I passed 9 restaurants, 6 bars, and 2 liquor stores. Well, now you might be asking, how many grocery stores does your neighborhood have? Well, on this map, it looks like a whole lot. What if I told you that it's actually 3? 3 total grocery stores for about 12,000 Pilsen residents. Now, Pilsen is what we would call a food swamp. Counties with many food swamps have an almost 80% increased likelihood of dying of a cancer related to obesity. A food swamp is an area where there are too many unhealthy food and drink options available. It's when there are more corner stores and fast food options than grocery stores. On the other hand, food deserts are when there's low access to grocery stores in an area. But we'll be talking about food swamps. A corner store isn't a grocery store. It's more like a convenience store. They have mostly prepackaged processed snacks, sodas, and alcohol. There are some staples such as cereal and milk, but it's often overpriced. Often, they don't offer fruits or vegetables. This means that there are too many nutrient-poor and high-calorie food options. This not only influences a community's eating patterns, but nutrition plays a vital role in our overall health. If my neighbor had better access to healthy food, it could have improved his diabetes management. Eating unhealthy foods over time can lead to serious, long-term diseases like diabetes. Doctors call these long-term illnesses chronic diseases. Racial and ethnic minorities are 1.5 to 2 times more likely than their white counterparts to have most of the major chronic diseases. Helen's Grocery here is actually a corner store. So is Miranda's, Guzman's Grocery, and almost every other pin you see. Let's walk into one of these corner stores. Here, we have $9 cornflakes, a variety of liquor, and cheap, affordable junk food and soda. If you only had $5 to spend, you could buy only a single mango, which isn't even a real meal. At this same grocery store, you could buy a large bag of hot chips, a pack of ramen noodles, and a Coke for that same $5. The hot chips actually have 93 grams of fat, or 137% of your total daily fat intake. Other fatty foods are things like fried foods, baked goods, and other processed snacks. Having too much fat in your diet can over time cause obesity, another type of chronic disease. Having too much fat can also result in an increased LDL, which we all know as a bad cholesterol. High levels of LDL can clog arteries, increasing your risk of heart disease and stroke. The ramen noodles have 1,520 milligrams of sodium, which is almost 70% of your total daily sodium intake. Eating too much sodium over time can cause high blood pressure. It can lead to kidney disease, heart disease, and even stroke. And you already exceeded your total daily sugar limit with a single can of Coke. Consuming too much sugar can lead to diabetes, obesity, and heart disease. This single meal is almost all of the recommended daily calorie intake for both men and women. Now, this is a single meal. Think of the rest of the meals or snacks you might be eating throughout the day, knowing you've already reached your calorie, sugar, and fat intake. Knowing you've almost reached your sodium intake. This single meal most likely isn't going to be your only meal this day because it isn't nutritious or filling enough. Now, this is one meal. Day in and day out, these are the realities of those living in a food swamp. This is one of the reasons why people living in a food swamp are more likely to have chronic diseases. The surplus of corner stores is an issue because unhealthy foods there cost less than healthy fruits and vegetables. Traditional grocery stores, on the other hand, have much better prices for fruits and vegetables than corner stores do. And research shows that when vegetables are closer to price than chips, people eat healthier. If you have a corner store right down the block just like I do, you're more likely to take the 3-minute walk to the corner store rather than the 16-minute walk to buy groceries. And if you do take that 16-minute walk to the grocery store, you're going to pass liquor stores and restaurants at every corner. Food swamps affect the Black and Latino neighborhoods of Chicago, typically people living in poverty. Children are especially affected. In 2021, almost half of all children living in Chicago were Black and 30% were Latino. In 2018, almost half of Latino children in Chicago public schools were overweight or obese, and almost 40% of Black children were. Latino and non-Hispanic adults worry about running out of food, or actually do run out of food, 3 to 4 times more than non-Hispanic whites in Chicago. Now, with the cost of groceries increasing, healthier produce costs much more than unhealthy snacks and processed foods. Not to mention that healthier produce is perishable and often goes bad much quicker than non-perishable, unhealthy food and snacks. Along with neighborhoods not having grocery stores in walking distance or neighborhoods saturated with fast food options, this is becoming a much larger problem. Over 230,000 Chicagoans have limited food access, meaning they live more than half a mile away from the nearest grocery store or supermarket. The answer to this problem seems very clear. If there's not enough grocery stores, build some more. But it isn't this easy. Let's look at Englewood. It's a low-income Black neighborhood in Chicago. When you look at this map, they also look like they have a lot of grocery stores. But we've seen this before. Englewood actually has a total of 2 grocery stores. So what are the other pins? This is the Community Food Center, which is clearly shut down. This is K Food and Liquor, a corner store that also sells liquor. These are not grocery stores, even though Google Maps says they are. In 2016, a Whole Foods opened up in Englewood. Its goal was to increase access to healthy food options for the neighborhood affected by food insecurity. People believed that the mere opening of the Whole Foods would benefit the entire community. The hope was that it would make a big difference, that other stores would follow. Smaller groceries and other corner stores might start offering healthy options. This was not the case at all. Many things were overlooked. One major issue was Whole Foods' affordability in low-income areas. Englewood's median income is below $25,000. That's only $12 an hour. The local Whole Foods earned the name Whole Paycheck, coined by local residents. For residents who are a part of the Supplemental Nutrition Assistance Program, or SNAP, and are paying with the Illinois Link Card, there's only a certain amount of money per month they receive on this card. It works similarly to a debit card. Someone in a single-person household only receives a maximum of $291 per month to spend on groceries. For 2 people, it's up to $535. For 3 people, it's up to $766 per month. The Englewood Whole Foods isn't affordable for those using a link card either. Also, only half of Englewood's residents have a car. During the Chicago winters with lower than freezing temperatures, walking to get groceries can be a huge challenge, especially with children. This limits their shopping options. The Whole Foods offered quality fruits and vegetables that just weren't affordable. This is why the Whole Foods was not successful in solving food insecurity in Englewood. A study of Englewood's Whole Foods' effect on food insecurity was concluded minimal even 2 years after the opening of its doors. 6 years later, this Whole Foods permanently closed. It was actually replaced with the Save-A-Lot, which is a low-price grocery store. Would you be surprised if I said that this grocery store still doesn't meet the needs of the community? How can this be if it's clearly affordable? It's because residents state that it doesn't provide quality fruits and vegetables. There's concerns about the freshness, physical appearance, and even contamination when it comes to the produce at Save-A-Lot. Just the year before, in West Garfield Park, the Chicago Department of Public Health shut down the neighborhood Save-A-Lot because of a rat infestation. This was that community's only grocery store. The establishment of the Englewood Save-A-Lot was met with controversy and resistance within the Englewood community for this reason. The opening of the Englewood Save-A-Lot was actually postponed due to a community protest, but is now open despite a ton of concern from residents. So the perfect solution here is both affordable and quality groceries. The solution to this problem is not just build more grocery stores. In Cook County alone, there was a 51% increase in food insecurity since 2018. The Healthy Chicago survey found the top reasons for difficulty accessing fruits and vegetables. The cost of fruits and vegetables was the main reason for this. The second reason was a poor quality of fruits and vegetables. And the third problem is the stores. Many neighborhood stores don't even sell fruits and vegetables. This map shows the percent of adults who have diabetes by census tract in Chicago. And this area here is Englewood. It stands out on the map. Next, we have adults who are obese, adults with high cholesterol, adults with high blood pressure. We start to see a pattern here, don't we? Inglewood, a neighborhood facing food insecurity, is affected by chronic diseases. Not only is it Inglewood we see in the darker orange, it's Chicago's west and south sides that are predominantly Black and Latino that are affected by these chronic diseases. Chicago faces many, many challenges, yet access to healthy food is crucial for residents' health, both now and in the future. There are many Chicago support initiatives that are in progress. But there's also a way that you can help address this issue. You can make a difference. Donate cultural food options to local food pantries and community fridges, or even make an online donation. I often see food in our Pilsen community fridge, like quinoa or tofu. It's healthy, but it remains untouched. The reason? It doesn't fit our cultural needs. Things like bags of rice, cans of beans, canned vegetables, canned soups, instant oatmeal, and even boxes of pasta would go such a long way. Things you probably shouldn't donate are things like sodas, chips, cookies, instant noodles, or canned meats. Donating food will increase the amount of healthy food options for families in need. And if you don't live near a food pantry, you can donate online to Chicago food pantries and depositories and help solve this problem. Although this is just a temporary fix, we're faced with a systematic, complex issue, and we have to start somewhere. Food pantries are much more accessible than stores for Chicago residents. You can make a big difference by donating online or to your local food pantry. This is one step closer to addressing food insecurity and making Chicago a healthier place.